Welcome to Age Lust, the podcast where we strip away the fillers and dive into the raw, hilarious reality of aging, desire, and wisdom. We're talking about the good, the bad, and the sometimes awkward, like sex, hormones, and all that TMI, and all those TMI moments that come with aging, and all those TMI moments that come with getting older. Try again. And all those TMI moments that come with getting older. I'm your host, Jessica Badonsky, a double board certified family nurse practitioner and mistress of menopause. I'm here to champion embracing your gray hair, except, down there where you can really wax away, and to remind you that you're never too old to catch an STI. If you do, though, shoot me a message and we'll tackle it together. Just a quick note, while I am a medical professional, I'm not your medical professional. Always check with your healthcare team before making any changes. So get ready for an honest chat, a few cringeworthy moments, and definitely some ways to take the pressure off. And if you enjoy what we're doing, please support the podcast by liking, sharing, and following. You can find us at agelust.co as well as on Instagram at agelust.co. That's C-O. All right, on with the show. I want to talk about something today on the Age Lust podcast that is a little bit unsavory. It might be a little bit gross. And I don't mind that. I don't mind gross. I don't mind unsavory, especially when we're dealing with anything below the waist. Now, I'm not talking about in intimate settings, but when we're talking about people's bodies and how to function better, and we're talking about genitals, I don't mind talking about below the waist and a little bit of poop and a little bit of pee. So, if you don't know, I am Jessica. I am the host of Age Lust. Age Lust is a podcast where we just talk about things that are too TMI, too much information. In fact, sometimes a little too much information is exactly what we need in order to help ourselves. And we talk about aging and how to live life fully and lustfully. So, have you ever heard of Rectocele? Have you ever heard of cystocele? Have you ever heard of prolapse? That's what we're talking about today. What are they? What do they matter? And maybe you have this. So prolapse is when things kind of fall down or fall out of alignment and out of place. And all human beings have pelvic floors. All human beings have genitals. And all human beings have rectums or assholes, and everybody has a bladder. Of course, needless to say, there are those people who have had these things surgically removed and replaced, but we're not talking about that. We're talking about typical human beings with typical body parts. And what can happen is that through life transitions, things change. Now, I'm going to focus mainly on people with vaginas and talking about the vaginal wall, as it has to do with prolapse. But let me tell you something. People with penises, they have prolapse too. Men have problems with rectocele and cystocele, where there's no vagina space that these organs will push into. But, if the prostate gets really big, they may feel some problems with their bladder. They may feel tightness, or they may leak urine or have problems with pooping. But let's talk about the pelvic floor. So we're going to start kind of from the beginning and build down and around. Well, actually, I want to tell you a story. I want to tell you a story about how I learned about Rectocele. Years ago, I was working as a nurse, which I am. I'm a nurse practitioner, so it means I have an advanced degree. I can write prescriptions. I took lots of board exams. I took two, in fact, one to be, I took my NCLEX, which is a board to practice as a nurse. I took my my certification for a family nurse practitioner, as well as a certification to become a menopause provider. And I'm working on a third certification because I'm just that wild. Anyway, so when I was an RN, I would work in an outpatient setting, one of the largest, if not the largest hospital in New York City. And I would go from internal medicine to pediatrics to GYN and rotate. And one time I was in pediatrics and I was working with a mother, and I don't remember what the conversation was. A lot of people tell me stuff about themselves that, I don't know why they tell me, but they tell me. And I guess I have that face that people want to tell me their personal details. But we got into this conversation about her pooping. And she said, sometimes when I poop, I can't get it out. And I have to stick my fingers into my vagina, and then I can poop. And I had no answers for her at that point. My focus was on sex and sexuality, but I wasn't thinking about Rectocele. I was really working with a lot of older people. In addition to my day-to-day nursing stuff, I was working with people 60 and older who and running groups around sex and sexuality. So I really didn't know what she was talking about at that point. But it wasn't until later when I went to grad school that I started to learn about anatomy a little bit differently, let me just say. And sometimes you learn things, but you learn so many things, they kind of get filed in the back, right? And you think about really complicated things. You'll think about people's life, I'm having a brain fart. Like that, you think about dementia and not just kind of too many things going on in somebody's brain. Anyway, back to the poop. So, the more I started to talk to people, questions would come up around having sex, and a female-bodied person would say, so I'm just going to say a woman. I'm just going to use that for very binary terms, okay? So I apologize in advance if that's hard for you, right? But let's just do it just to be simple about it, right? So I would talk to women and they would say I'm having sex, and all of a sudden I'll be wanting to pee, but I don't want to orgasm. So we would talk about squirting and that kind of sense of relief. And a couple women would be like, no, don't want to orgasm. It's just this overwhelming sensation that I have to urinate, and it's not pleasurable. It's like I have to pee really bad. Or somebody would say we're having sex, and then all of a sudden I have to poop. I have this feeling that I have to poop. Well, when you kind of parse out for kinks and say well, that's not it, right? It's not a turn on. This is actually a discomfort that some people are experiencing. The more and more I started to learn about rectocele and cystocele. So what these are, when we think about prolapse and we kind of think about things falling down or pushing into spaces that they shouldn't be, the most obvious one for a lot of people is considering uterine prolapse, right? So that the actual organ, the uterus and the cervix are kind of falling down into the vagina. Oh, let me be really, really clear here, especially, I'm going to be sexist right now, especially if you're a guy who doesn't know shit about female anatomy. Or, you know what? Anyone, right? Because this happens all the time. Everything you see on the outside, when a person opens their legs, when a woman opens their legs, the hairy bits, right? Pubic hair, that part of the vulva, the majora, that part is the vulva. The tinier lips, which can be longer than the area that holds the pubic hair, right? The labia minora, right? That is also the vulva. When you open even more and you see the clitoral hood, the clitoris, and you can even see the hole maybe where the pee comes out, that's the urethra. And then below that is a hole that is the actual entrance to the vagina. The vagina is on the inside. Please don't call everything you see on the outside, everything you can touch, without going inside a person's body. The vagina, that is not the vagina. The vagina it actually means sheath for sword. It is the pocket. It is the vaginal canal. It is the inside of a woman, of that area, right? And so I want to just get that really clear. And the vagina has ridges. And it has ridges because it expands and contracts. It even expands when we are aroused. So this whole concept of like a tight, you know what, okay? And when we get turned on, the back of the vagina will get bigger, right? Okay. So the vagina, inside of the vagina is wavy. It also gets a lot of innervation, meaning blood. A lot of circulation happens there. It's lubricated. And these are the things of like a really kind of healthy vagina. Anyway, this is really important. I'm kind of backtracking. So there are walls. There's an anterior and a posterior, even though it's a tube, right? Anterior and posterior wall. So we're talking about there's a wall that's towards the back of the body, and there's a part of the wall that's towards the front of the body, closer to the pubic bone, closer to the backbone, right? And we talk about those vaginal walls. And when we talk about prolapse, what is happening is that unlike the uterus coming down through the vaginal canal, right? You've got the bladder in cystocele that is pushing into the vaginal area, like pushing into the top vaginal wall, right? And in rectocele, you've got the rectum, or kind of the pocket that's holding the stool, that's pushing into the vagina in the back. Now, you don't have to have both of them at the same time. You can have just cystocele, and you can even think of the word, if you've ever had urinary tract infections and you hear the doctor or nurse practitioner or whoever your provider is talking about cystitis, right? Bladder, rectum, just so you can get comfortable with those words. You can have one and not the other, or you can develop one and then possibly develop the other as well. So say somebody has like a little bit of cystocele, and it is graded 1 to 4. You can have a little bit of cystocele, but as they're aging, maybe they're constipated, all of a sudden they have more. All of a sudden they now have rectocele as well. Okay. So this can cause a lot of discomfort and actually can cause infection eventually. Not because there's actually urine or stool inside of the vagina, right? But as these things get more pocketed and kind of stuck in there, you have a harder time emptying the bladder, for example, or if you're so constipated and you're also creating problems with space, you can see where it can be uncomfortable and cause more serious problems. And UTIs, urinary tract infections, can be very serious. Like, they can be deadly. All right. So, where was I? What did I want to tell you about this? So, this is kind of, those are these things that people don't really talk about. And they notice that there's something different, something happening, like their bladder's not emptying properly, or they feel like they're not pooping properly. Like they may have been kind of constipated, but now they're really constipated, or, again, sex, right, is kind of showing them that something's up, or they're walking around and they notice that like they haven't pooped in a while, or they've peeing, but they don't feel, or maybe you've been able to hold your bladder like for a whole 12-hour shift. All my nurse friends out there, right? And like it used to be okay, but now you're like peeing, but you're not emptying your bladder fully. It's just, there's a change, a subtle change. And one of the things I want you to know is that pain is not normal, even with aging, number one. And number two, if you say something to someone, a provider, they hopefully will acknowledge it and dig in and figure out what is going on. All right. So let's talk about why this may happen. So one of the most obvious things that can cause this are life transitions. And we're talking about pregnancy and perimenopause into menopause. So what happens in pregnancy? And I want to do another caveat with pregnancy as well. But let's talk about pregnancy, for example. So when we are pregnant, some of us gain a lot of weight. I am a person who gains I get 200 pounds when I'm pregnant. It gains a lot of weight. You've got a human being growing in you. Organs shift around. You also have a shift of hormones that happen. You're flooded with hormones. There is more fluid retention for people. It is just a lot of work on the body. Being pregnant is a lot of manual labor on the body, not to mention actually going into labor and giving birth. And with that, we have to think about what is supporting not only the pregnancy, but the organs on a daily basis. And there we're talking about the pelvic floor. And the pelvic floor is made up of 4 different muscles. They create like a sling. And if you really want to take it back and kind of imagine the job of the pelvic floor, you can maybe think of the 1900s, and maybe you went clubbing. And maybe when you went clubbing, there were bouncers. And maybe if you were like me and some of my friends back in the day, where we would like go out every night except for Saturday, because Saturday was for people who were coming into New York City. We didn't go out on Saturday. But whatever, if you went out every night and kind of did a certain circuit, you knew who everyone was, and you knew who the bouncers were, and you knew who the bouncers that were really tough and like not super rigid, not flexible at all. And you knew the kind of places where like the bouncers were garbage and you could have some real problems at. But then you had the bouncer friends who were great, who knew when to be rigid, knew when to be tough, and also knew when to be flexible and kind of let people in, or even calm the situation down, right? Depending on where you were and what you were doing. So the pelvic floor is that bouncer, right? And you want that bouncer to be both firm when they need to be firm and flexible when they need to be flexible. Always flexible, but, relaxed, chilled out when they need to be chilled out. Also supporting the pelvic floor, and this is for all human beings, right? Everyone has the pelvic floor. So also supporting the organs in the pelvic floor, right, are the abdominal muscles, specifically the transverse abdominis, which is like the girdle, like your faja, your natural faja, right? You also need your back muscles to be strong. So when we think about core exercises, working with the core exercise, we're talking about working with the back, working with the belly, deep inner layers of the abdominals. So we're not necessarily talking about the six-pack. Six-pack is cute. It's mainly visual. We're talking about the deeper layers of the abdominal muscles. And really importantly, almost or with equal importance, would be the diaphragm. And it's kind of reflecting the pelvic floor. So the diaphragm is this like the top of a drum, right? This tissue that is at the base of the lungs, so the base of the rib cage. And when you expand your rib cage, take an inhale, the diaphragm expands out, right? So it's like making space to suck the air in. And when you exhale, right, the rib cage will go ahead and get smaller and the air comes out. Now, in opposition to that, you may feel that the pelvic floor as you exhale, right, the pelvic floor, if relaxed and flexible, will come up. Now, the deal is that if you don't have proper instruction, if you don't really have body awareness, and you're trying to, like, you're thinking to yourself, oh, I think Jessica may know, like, she may have pointed me in the direction, like this, I might have one of these seals happening, right? I'm going to do some push-up, I'm going to do some sit-ups and really crunch it out. You may notice that there's a bulging that happens. And sometimes when we do abdominal exercises, sometimes when we do Pilates even, which is awesome, but if you do not know what you're doing and you do not get proper instruction, you will feel yourself pushing the pelvic floor down, right? And further pushing against and unsupported, like, so that the vaginal walls are not supported, the pelvic floor is not supported. It's going to feel more bulgy. And a great example of this is the CrossFit games. I love watching the CrossFit games. I love watching really strong people, but a lot of those women who are competing are like pissing on themselves because they have no knowledge of their pelvic floor, right? They're thinking I have to tell you, they're thinking in a really binary kind of way, and instead of understanding their anatomy, they're kind of powering through it. This can also happen with runners. Go back to the pregnancy, right? With all of these hormones, you have something called relaxin that kicks in when you're pregnant and makes you very flexy bendy, so everything can move and bend and get bigger. But if your core was not already firm, strong, and I'm not talking about thin six-pack, like, please, right? But if your back and your core were not in good alignment and strong, this relaxin kicks in, you've got all this extra weight, extra water weight, a human being growing, all of these things, and there can be more pressure. Not to mention actually pushing human beings out can further exacerbate the issue. I got to tell you though, I know people who have given birth, vaginal birth, to multiple babies, sizes 9 pounds to 12 pounds, 9 pounds to 11 pounds, home birth. I'm putting the person's face, image, name. I know the kids. She does not have this. This is not that everyone has it. So also, do not get it twisted. Oh, so-and-so had so many babies, they must have it. No. Not everyone has this. And I know equally women who have never been pregnant, never given birth, runners in particular, and I'm thinking about one or two people, very thin, very tight, very peeing all the way down the marathon trail, peeing all the way down. Don't make her laugh. Don't make her laugh because she's going to piss all over herself. Okay. But pregnancy is one of those things. And after pregnancy, when you push the baby friend out and possibly even breastfeeding, you have a huge drainage. Such a bad word. A huge shift in hormones. And with breastfeeding, you may notice that you have vaginal dryness. You're not ovulating. Your brain literally has told your body, look, we're not getting horny. We are not trying to make a baby. We are not ovulating. We are about feeding this baby. And this lack of estrogen to the vaginal walls will cause discomfort, dryness. It will further compromise vaginal walls that may be compromised from the intense labor of pregnancy and actual birthing. And that compromise can start the beginnings of cystocele and or rectocele. The other thing is that constipation is a huge thing in pregnancy, huge thing in pregnancy and postpartum. One of the glorious things about periods, especially if you have lived your life, I told you this is going to be like a little bit raw, right? If you have lived with periods of constipation, one of the glorious things about your period is period pooping, right? I know people get grossed out by it, but like everything, like day 2, from like day 0 to day 2, maybe you're like just letting it all loose, just releasing a total clean out. You're bleeding, you're pooping, you're like, I feel light as a feather, messy, but light as a feather. So that changes too. So that's the first thing, right? The other big shift that I have to think about, of course, is perimenopause and menopause. So with that, you may first notice in the perimenopausal journey that the progesterone goes down and you've got heavier bleeding. Your periods may last longer. You've got clotting. You can't sleep. Like something's just like off. But then the next thing to happen as estrogen spikes and drops and spikes and drops and then starts to drop, is that some women will notice that all of a sudden they're getting more UTIs, or what they think, or they'll going to their provider and they're like, I think I have a UTI. I think I have like some kind of something's different. So either something's different with me or something's different with my partner. Like something is not right. Something's up. That is the drop of estrogen. And a lot of times what will happen is that there's no UTI, there's no infection, there's just dryness and discomfort. For some women, it is so severe that they can't even wear underpants or pants. Like they have to wear dresses. And I don't know, maybe they wear bloomers. I don't know what they're doing, but they're just so uncomfortable. In fact, you know what I wonder? I remember being in nursing school with this one woman, and she was older than us, right? So I was in my 30s when I went back to nursing school, and she had to be in her 40s. And she did not wear underwear. She only wore panty liners. I don't even remember her name. However, I remember that because that's how my brain works. And I would always like think about like the panty liners, and she didn't wear panties. She only wore panty liners. And then like the line of the scrubs, the seam, like this is the shit that I would like occupy my mind with. Anyway, I wonder if she had some vaginal dryness. So some women will have discomfort and they will think, or even possibly have infection from that. And that is from that drop of estrogen that happens in that transition. And when we don't have enough estrogen, what'll happen is that we can have decreased lubrication. Decreased lubrication means that there's less action happening, right? Because we're uncomfortable. And the actual vaginal tissue will start to thin. Now, you might have listened in a past episode that I did on the actual vulva that says that the inner lips, right, the labia minora, or some people don't like lips. Like, get over it. The labia minora, the smaller, which can sometimes be longer, right? The inner lips, whatever you want to fucking call it. The labia minora, gets smaller through menopause and postmenopause because we don't have that estrogen. The same thing will happen with that ridging that I was telling you about. So that ridging that happens in the vaginal walls starts to decrease as well, and the walls become thinner. I had something I just wanted to say about that. So yeah, the walls become thinner. You know what it's like? It's like a balloon, right? The vagina is like a balloon. And you have the balloon and it like can really expand. Remember, like a lot of people in, a lot of people out for some people, right? Think of like those 20 and counting. Like that woman had like one guy in, but as far as we know, right? And lots of people coming out of that vagina. It really stretches like a balloon and then pops right back. It's not really like a rubber band in a way, because like when a rubber band gets dried out, it becomes super brittle and can crack. But I think of the vagina more of like a balloon that is left out in the sun, and then it kind of gets those ripples and like loses its integrity. However, the vagina can get so dry that it will and thin that it will tear, and that's called friability. Anyway, when it comes to rectocele and cystocele and infection, think about it. The area that tissue is not as bouncy and doesn't spring back to where it should be. It's not as full, it's not as thick, it's not as lubricated as it once was if we really let it go. Because I'm going to give you suggestions to kind of stop it in its tracks. But add on top of that, you're not hydrating, you're not drinking because you're too scared you're going to have to pee, because you're not emptying your bladder properly. One thing. So you're not hydrating, so you are then kind of walking around like not emptying the bladder, putting pressure, and then that bladder is pushing into the vaginal wall. Or with rectocele, you don't have the progesterone, you don't have the estrogen, you're not pooping as you should, you're not eating enough fiber, and lo and behold, the stool starts to back up, and then it's pushing again into the vaginal walls. Remember, this is not everybody. This is not everybody, but it's enough people that they sell Depends. Okay? It's enough people that they used to sell this little tampon thing that worked as a pessary. A pessary is something that you usually get fitted for, and it's this circle, and it gets placed into the vagina to push the walls away, all right? And so you don't have that full feeling. And it's probably enough people that if we all talked about it, we could get solutions for it. Okay. But again, everybody. So here you go. You're 50-something years old. Maybe you're dating again. Maybe you're playing with toys because you're like, here I am. I'm in this new phase. Or maybe maybe you're 60 years old. Maybe you're 70 years old. Maybe you've got a new partner. Maybe your partner and you are using dildos. I don't know what you're doing. But you notice this desire to poop. Or you notice that if you stick your fingers in your vagina, you get the stool out. And you don't know how you came up with that, but that made sense to you. Or, you're getting more urinary tract infections. And maybe your provider mentioned, oh, yeah, you've got grade 1, grade 2 of a prolapse, right? Please, there is a solution. So what are those solutions? One of the first things, let's go from like least invasive to most invasive. So for everyone who might be dealing with this that has a vagina, the first thing to do is if you are having vaginal dryness and you're feeling even the touch of discomfort, or if you kind of have a little bit of dryness and you're still sexual, like as sexual as you were, when you had a baby, lube. Lube is a temporary situation. It's for the moment. It's for the time. There are different types. Don't use silicone with silicone toys. Don't use oil-based if you're going to use a condom. And know that water-based is going to dry up really fast. Don't use spit. Don't use spit, please. It's gross. I don't like oral things. And spit dries really, really fast, by the way. It dries faster than water. Okay. So lube. The second step above lube, a little bit thicker, is vaginal moisturizer. And a vaginal moisturizer is something that you put inside the vagina. It clings to the walls of the vagina, and it's like that. It's like a moisturizer. It's like the difference between putting a lotion on your skin or putting like a thick cream on your skin. So those are over-the-counter solutions. Very easy. Don't use Vaseline. Please don't use Vaseline. That's real old school. There are better products. There are products that taste good. There are products that smell good. There are products with no taste that are thin, that are, if you can't put it in your mouth, don't put it in your vagina. Okay? So that's how that goes with lube and moisturizer. Next step would be, and we did also talk about a pessary, right? Seeing your doctor, getting a pessary, but that's a little more on the more invasive side. The next step that's really helpful is estrogen, estradiol. So, and I'm not talking about systemic, I'm not talking about HRT, hormone replacement. I'm just talking about right there for the moment, spot treating the vagina. And that comes in 3 different forms. It comes in a ring that you place into the vagina. It stays there for about 3 weeks. It comes in a cream that you would use a few times a week. It's a little on the messy side, but it works just fine. You actually can take a little of that cream and just put it on the outside of the vulva. Yeah, right, vulva, as well as into the vagina. And there's also a tablet that you can get that is placed specifically for the vaginal estrogen, and you enter it and place it in the bottom third. This is so freaking important. The bottom third of the vagina. So you pop the pill in or you put the cream in, and then you lay your ass down and go to sleep. Okay? Again, if you're using the cream, don't have sex with a condom. It'll go through the condom. Just wait till the next day to have sex. Okay. Moving on from there. So we talked about lube, we talked about moisturizers, we talked about pessaries, and we talked about, I guess it would be vaginal estrogen, and then pessaries would be a little more invasive. Oh, fuck. You know what I didn't tell you? The least invasive. The least invasive. Okay, so now we're going to... No. Let me just go on. So the most invasive would be a surgery. Having rectocele, cystocele surgery. That's done in different ways. There was a whole thing with mesh and slings and that sort of thing. But you have to find a specialist, a urogyne specialist. So a urologist that is very well versed in gynecology so that they can help you and get you all set up. There is a pelvic floor PT who talks about how she actually runs a course called the Buff Muff. I'll put her information in the notes. But she talks about having surgery after doing all the things, and I'm going to talk about some of the things she did to support her pelvic floor and her vaginal health. And she felt that surgery was the best decision for her. And as far as I know, when I check in, she doesn't know me, but when I check in through the interwebs, it seems like she's very happy with that choice. There is recovery time, but eventually you're pooping, you're having sex, you're doing all the things without discomfort. So that's the most invasive. Let's talk about the least invasive thing. And the least invasive is to find that balance between firm and flexible. Or firm and or it's always flexible. You can be firm and flexible, but you know what I mean? Releasing and holding on. So years ago, I was part of I'm going to take a sip of water. I was part of a advisory board for a Kegel product in Canada. They flew me out to Canada. It was lovely. I really liked it. I love doing that stuff. If you want me on your advisory board, write to me. I loved it. Loved it. Loved it. Anyway, I got to meet all of these people. I got to learn about, so this about close to 10 years ago, I learned about the North American Menopause Society. I learned that pharmacists in Canada are allowed to prescribe hormone therapy. I talked to a lot of physical therapists, in particular, pelvic floor physical therapists. Pelvic floor physical therapists do this work, and they figure out how to support you and give you exercise. And it's like any other PT. There are also urology nurses that do some PT-like work with people around urology. And that's another awesome option. A more invasive, less invasive than surgery, but you are working with somebody, and they will be probably sticking their fingers and tools into your orifices. Okay? Whether that's the rectum or the vagina. But one of the PTs got up and gave a presentation that was so amazing. So it was a very robust practice that this person had. And she said, about 86% of the people who come to me with weak pelvic floors are actually, they don't have weak pelvic floors. They're actually hypertonic. So what does that mean? That means that it's like if you took a weight, put it in your hand, made a bicep curl as hard as you could. You put your fingers right between where the elbow creased and where the bicep and the forearm were, and you said squeeze, 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 and you were already making a fist because you were holding like a 20-pound dumbbell, and they said, oh, work harder, squeeze harder, right? Because you can't squeeze any more than you're squeezing. That's a lot of times what happens when the gynecologist sticks their fingers into your vagina and says squeeze, and then they say, oh, do more Kegels. One way to know if you're really holding on to some tension is what I learned in my doula days, is if you've got tension here in the jaw, and I grind my teeth. If you have tension in your jaw, you probably have tension in your pelvic floor. One thing to check is, can you do this? Can you go? If you are going, chances are you need to do some deep breathing. You could do it a couple more times. Inhale. Hold it. Exhale. One more time. You could figure that out yourself. And then try again. And see how that feels in the pelvic floor to just release. Okay? You can do that on the toilet if you are constipated. It's just a really good thing to do. And I think just fluttering the lips just kind of chills you out. So she said that most of the people are hypertonic that come to her. So in that case, Kegels is when you try and firm the pelvic floor by cutting off the flow of urine. So you pretend, or you can practice on the toilet where you're peeing and then you try and cut it off. Most of the people don't need to do that. What they need to do is release and relax the pelvic floor. So yoga is a great exercise to help you, like the exercises of yoga, the asanas of yoga, squatting are really excellent in releasing the pelvic floor. Remember I talked about the diaphragm, right? Diaphragmatic breathing, where you actually release the belly. Don't think about the belly at all, but you're sitting up or even standing up, like in low pressure fitness, which is like chef's kiss, the best for a pelvic floor. I would say even not better than Pilates, but it is an important step before you were to engage in learning Pilates on your own. How's that? Where you do diaphragmatic breathing. So diaphragmatic breathing is you would take a deep inhale, you expand the rib cage, right? And then as you exhale, the belly is still relaxed, right? You think about keeping that expansion as you exhale, making space for the pelvic floor to just stay a little bit higher and not push down, right? Because a lot of times when people try and exhale, you can do it right now. Forcefully exhale, you can feel the pelvic floor push down. Low pressure fitness is another, it is one of my favorites. So low pressure fitness actually changed my life. I have Rectocele and cystocele. I probably have grade 1 of both, but like I figured all of this out from being knee deep in menopause, sex, and just all things genitals. I'm interested in it, right? And trying to figure out what's going on with me. So I have Rectocele, I have cystocele, and I used to run and like piss all over myself. And in fact, my partner, when we were first dating, he's a huge runner and he's like, come run with me. And I was like, this is fucking embarrassing. Okay. Low pressure fitness has gotten me to a place where I can jump. I can like do like little box jumps. I'm not like a big box jumper, but I can like jump and I don't piss. I can dance and not piss. I can run and not piss. I can skip and not piss. I can do a lot. 5 minutes. Are you ready? Okay, 5 minutes. Hold on. I'm almost done. Okay. So, low pressure fitness is a combination of breathing, exercises, low pressure on the pelvic floor, and you do hypopressives where you kind of like suck in, but you don't actually suck in. It's a little more complicated, and movements, and it's been game fucking changer for me. Anyway, here's the point. The point is that this is a real thing, cystocele and rectocele. There is help. I want you to find help. I want you to find support. And that's about it. And no shame. No shame if you are suffering with this. If this is something that you're like, this is like, I'm not suffering, Jessica, but this is a little something that's annoying. There's a ton of help. So that's it. I hope you enjoyed the episode. Write to me if you have questions. Please like, subscribe, share, do all those things. Support this podcast, Ageless. I have a lot of episodes coming up. I hope to have a master teacher of low pressure fitness come on to the podcast. I'm going to be talking about sex positive parenting with Melissa Carnegie, and just a lot of super exciting things coming up. Again, thank you for listening. Thank you for subscribing. Thank you for liking. Keep doing those things. And that's it. Okay. Thanks. Bye. Thanks for listening to Ageless. If you enjoyed the episode, please follow, like, share, give it 5 stars, thumbs up, all those things. Aging is a slow burn. Let's slap it around and keep it hot. Catch you next time.